We get this question a lot. Should I be paying for speech therapy, ABA therapy, or both for a child with autism or a toddler showing signs? Today, I'm covering that. Okay, welcome back. If you're new here, a special welcome to you. And we're going to dive right into this very brief, I think, solo show. I was recently at a conference where I was speaking. It was for Team Mario down in Texas. Show a shout out to Melinda and all of her parents and professionals who helped organize such a great sold out conference down there. And one of the members from my online course and community was present. And she was asking me about should she continue to pay for private speech therapy? Her son wasn't diagnosed yet, so she didn't think she qualified for ABA therapy. So I think there's a lot of confusion, and I thought I should cover this because it's not just this one woman with this one question. There's a lot of layers to this question. So in the United States, which I know we have people from all over the world listening, but our primary audience is from the United States. So I'm going to, give some specific regulations and rules and laws that are from the United States and touch a little bit about other countries. But in this case, this woman was from the United States. She lived in Texas, and her son wasn't diagnosed yet. So she had an evaluation coming up in a few months from now. But she was taking her son to private speech therapy, and she was paying for that therapy. And she was wondering if she should continue, because one of the reasons she was wondering she should continue is because in my talk, I covered the 5 mistakes from my perception that parents and professionals could be making, including focusing on length of utterance and focusing on abstract concepts before basic functional language was mastered. So in the talk, and I've done a podcast on this, the 5 mistakes. We can link that below in the show notes. So you can listen to the 5 mistakes. It's pretty much what I talked about at the conference for that part of it anyway. So she was doing the early learner materials and everything that we suggest in the course. But then when she was going to speech therapy, the speech therapist was making some of the mistakes that I had mentioned. So one of the first things I told her, which she did not know, is if your child is between the ages of birth to 3 years of age in the United States, you can get a free evaluation, or in some cases, a low cost evaluation. But regardless of how old your child is, if they're under 3, if their age is 3 to 5, or if they're school age, you can get an educational evaluation. You can get occupational therapy evaluation, physical therapy evaluation, and speech therapy evaluations for free or very low cost on a sliding scale. So she didn't know that. She thought her only options for speech therapy was private pay. The other thing we need to look at is whether the child has medical insurance. I know when Lucas was 2 years old, and we started speech therapy for him, our health insurance covered 15 sessions of speech therapy. So before I would pay for services, I would look into both medical insurance as well as the educational system. And it's different in every state and every county. So I would suggest Googling, searching birth to 3, city and state, and see who to call. You can also check with your child's pediatrician, or if they go to daycare or preschool, they are usually in the loop with how to get those services. Same situation, a different organization probably controls the 3 to 5-year-old level. And then, of course, your school district, you could always call them and say, I have a 2-year-old and I'm wanting a speech therapy evaluation. Do you know who I would call or contact for that? So there's a whole column of medical insurance and what they cover, and a whole separate system for educational. Then the third option is to privately pay. So sometimes if these systems are too full or there's a wait list, sometimes medical insurance will pay for more private speech therapy or services because their system is too backlogged. So the same situation for ABA. So I'm a behavior analyst, as those of you know who have listened to the show before, and I believe that kids with a diagnosis of autism, really anybody can benefit from good quality, child-friendly, positive ABA. So if you have a diagnosis, and kids that have a diagnosis really need many hours of ABA therapy per week. We're talking 20 hours, 30 hours, even 40 hours a week of ABA therapy. In addition, though, I would say that you want to make sure that the ABA provider is using a verbal behavior approach, is familiar with my work, and you still want to be what I refer to as the captain of the ship, as the parent. I talk all about this in my Turn Autism Around book. I talk all about this in my online course and community as well. So you can also, for ABA therapy, look at your medical insurance. And now in all 50 states, autism is not excluded and ABA is covered in most cases. So you want to look at your medical insurance. You can also look at the birth to 3, 3 to 5, and your school district to provide ABA services as well. So I told this woman that really I wouldn't be driving, spending time and paying for things, services, if the child wasn't happy to go, if they weren't willing to work with me as the parent, as the knowledgeable parent and the captain of the ship. They weren't willing to let me sit in on the service or let me view through a two-way glass. Maybe not all the time, but they shouldn't be excluding you. They shouldn't be working on goals that are too hard for the child, that don't go hand in hand with the child's assessment and plan. And for over a year now, we've been offering the digital assessment that I created for free. So marybarbera.com/assessment. You can take that assessment. It'll take you 10 minutes, create a plan, and then make sure your goals, no matter what services you get, are in line with your child's unique strengths and needs. So regardless if you're paying or insurance is paying or the school district is paying, you have to think of your time, your child's time, and if the child is happy and if the child is making progress. There's other things, like in episode 3 of the podcast, way back, I interviewed Kelsey, who comes on my show quite a bit. And Kelsey was driving to ABA therapy, and she was driving an hour each way. That's a lot of her time. That's a lot of her kids' time. She had Brentley with moderate to severe autism. She also had Lincoln, who was a baby. You get an hour out, and so you pretty much, I don't think it was a whole day program. So she'd have to hang out outside of the clinic for hours and then pick him up and drive him back. But all of that extra energy and gas and, all of that, and time when they could have been doing other things was not working. Brentley was continuing to bang his head on hard surfaces up to 100 times a day. He was eloping. They were working on colors when they should have been working on manding. And when Kelsey started questioning, they pretty much pushed her back and told her that, they knew what they were doing and that was their procedures, that they were going to work on things like colors. And so in that situation, it becomes clear. It doesn't matter if it's covered by insurance, if it's quote unquote free. It's not free when you're wasting your time, your gas, the precious hours when the child could be making progress. So I think in general, we just need to look systematically at any of the services your child is receiving or could be receiving and make those decisions. I also talked to a friend of mine with a high school child, a 17-year-old, who has been homeschooled for the past 6 or 7 years. And now he's having some behavioral issues. And so I recommended to my friend. I also would recommend to anybody out there, if you have decided to homeschool your child in the past and it's not working, you can always call the school district and ask them for a multidisciplinary evaluation, and they should be providing more services to help you, even if you continue to want to homeschool, or maybe it could be half and half. And my friend didn't know that his son is 17 now, and he was kind of like, well, there's only like really another semester worth of, is it worth all the extra aggravation? He didn't know in the United States, and maybe you don't know this either, the kids with severe disabilities like moderate severe autism can go to school until their 21st birthday. And usually the year, if their birthday falls within the school year. So this boy has a lot more years, 3 to 4 more years of services that the school district could be helping with. So again, my friend was very much like, I'll pay for things of it, just hold on. Don't whip your wallet out to pay for things, because if I paid for every service Lucas has gotten over the years, I don't know what that would tally up to, but it would be a whole lot of money. And in the United States, it is very clear that we have a whole educational system that is required to deliver a free, appropriate public education, which includes OT, speech, PT, visually impaired services. It includes a whole lot, psychological services, behavior analysts helping if it comes down to that. It provides a lot. And your medical insurance also provides for a lot as well. And just sitting back and coordinating all of that. And that's why I am so passionate about my online course and community, because we can help both parents and professionals in the groups, in the toddler preschooler group or in the school age group, really help them learn what to do, learn how to navigate, learn how to advocate, and work together to help each child reach his or her fullest potential. And that's always been my goal. So that's what I have for you today. I think the answer to should I pay for private speech therapy, ABA therapy, or both is usually no, you shouldn't pay privately for things. unless you've explored the medical system and the school system to help cover those needed services. So thanks for listening. If you loved what you heard, I would love a review on Apple Podcast or wherever you're listening. And I will see you back here next time, same place.